Hi, everyone. Welcome to The Hot Dish, comfort food for rural America. I'm Heidi Heitkamp.
And I'm Joel Heitkamp. Today we're joined by Cynthia Cox from the Kaiser Family Foundation. Cynthia is a vice president and director of the program on the Affordable Care Act for KFF. She conducts economic and policy research on the ACA. Cynthia is here today to talk about all the things the ACA has that we're lucky to have, and we're lucky to have her. Cynthia, welcome to the Hot Dish, and thanks for joining us.
Thanks for having me. It's great to be here.
And we found out another factoid about you, that my husband once upon a time installed your doorknobs on your condo because you lived in the same condo as my daughter.
Yeah.
It's just such a small world.
DC is a small world in that, right?
Yeah. Well, I mean, not just DC, but, it's amazing. You can sit down in an airport and find out. But what an interesting area of study, especially right now, Cynthia. Obviously we're paying really close attention to what's going on in Congress, really close attention to all of these increases in healthcare. But one of the sources, and I will tell you this without trying to blow any smoke, that I always tell everybody, the most trusted source for data and information is KFF, or Kaiser Family Foundation, now KFF. And so we're so grateful that you're able to join us and maybe shine some light on what's going on with healthcare costs today. And Joel talks to farmers and to people in middle America every day. Joel, what are you hearing about healthcare costs, and how concerned are people?
Well, I think some of the people, as they get closer, Heidi and Cynthia, I think they're starting to come out of the woodwork. Here's kind of the weird thing in the beginning. I shouldn't say weird thing. I should have expected it, but a lot of people, Cynthia, who are on the exchange don't want to admit they're on the exchange because, of course, they see it as welfare and they don't want to admit they're on welfare, even though it's an absolutely great program that makes sure that it benefits the rest of us that aren't on the exchange. But I don't know if you're seeing that, Cynthia, but I'm seeing more and more people now come out as though this is a problem that they have to address.
Yeah, I mean, I think I think also just the way that the ACA has been called Obamacare for a long time. People didn't want to be saying that they had an Obamacare plan or that they needed Obamacare. But I think over time, perspectives on that have evolved, and also, I mean, this is private insurance, but private insurance is expensive, and most people in the United States, whether you're getting insurance through Obamacare markets or through work or Medicaid or Medicare, are getting some sort of subsidy or financial assistance to do so. It's actually like very few people in the U.S. who actually get full priced health insurance. And so the ACA or Obamacare markets help people who do not otherwise have health insurance because they don't get it through their jobs. Maybe they work a job that's, they're self-employed, small business owners, farmers and ranchers, people who just don't get health insurance through work come to this market to get private health insurance, and they get financial help to afford it because it is very expensive.
Well, when you step back and you take a look at it, one of the arguments that we've been hearing over the last couple of weeks is that that Obamacare has actually driven up the cost of healthcare. How do you at Kaiser kind of, or KFF, sorry, I know for the initials, but how do you respond to that? Because you've obviously been pretty aggressive on the Republican plan for high deductible, and we can talk a little bit about high deductible health savings accounts. But how do you respond to the basic argument that they're saying that Obamacare has driven up healthcare costs?
So I think there's like a lot of different ways to look at healthcare costs. There's how much does an individual spend on their health insurance or their healthcare out-of-pocket costs. There's how much does society spend, as a whole. And there's also how much does the federal government spend. So I think it depends on, how you're looking at this. But if you're looking at it from a societal perspective, like how much we spend overall on healthcare, we do spend more now than we did before the ACA. But actually the rate of growth has slowed. So, we spent like the rate of growth of how much healthcare spending is growing each year is a little bit slower than it used to be before the Affordable Care Act, despite the fact that many more people have health insurance coverage and can access that healthcare, in many cases better than they could before the Affordable Care Act. Then when you look at just the people who are getting health insurance through the ACA or Obamacare markets, that's where there's a little bit more nuance. So what people actually spend on their premiums has been pretty flat, if not falling, because of these extra financial help, like the enhanced premium tax credits that people get. How much insurance companies charge has also been pretty flat for the last few years. But when you compare how much insurance companies charged individuals, so these are people, again, who do not get health insurance through work or Medicaid or Medicare, it's just the people who are buying their own health insurance. Um, Before the Affordable Care Act, on average, premiums were lower than they are today, much lower. But a big part of that is because back then, people who had pre-existing conditions were, often excluded from having health insurance. And the health insurers didn't have to pay for people's treatments. A lot of healthcare wasn't paid for in that market. Prescription drugs or mental health care or pregnancy care or that sort of thing might have been excluded. So, yes, premiums were lower and insurance companies were paying a lot less for care than they are today. But today, that care actually, or the insurance coverage actually covers people with pre-existing conditions, and it covers the treatment that someone might need who gets sick.
And you also have tests like colonoscopies and breast cancer that are mandated with no fee. And so we're just getting better health care. I mean, I will tell you that same guy who installed your doorknobs is also a family physician. And he could, when Obamacare kicked in and people could come in and get screenings, he was convinced that at least a dozen of his patients had their life saved with early detection as a result of the new healthcare law.
Yeah, I mean, there's so many ways that you can measure how, just improved access to care has led to not only better health outcomes, but also better financial outcomes for people. I think the other thing, even when someone has a relatively high deductible plan, they still have that kind of protection from catastrophic healthcare costs that they wouldn't have had if they had no insurance, or if their insurance had no, limits on how much that plan could charge someone for their out-of-pocket costs.
So, Cynthia, what are the providers saying? I mean, we talked a little bit about, those individuals that are using, the market and coming in and seeking that help for affordability. I mean, I've got a ton of farmers where this is what they do. They don't have enough employees to organize a plan of their own. So, but what are the providers, those folks that they're going to see to get that kind of help? What do they say?
Well, hospitals in particular are pretty concerned about the enhanced tax credits expiring. They're also concerned about other changes that were made earlier this year in the summer with what was called the Big Beautiful Bill. Also included a lot of cuts to Medicaid. And when you add all of that together, we're looking at, like, in the future, there's probably going to be about 14 million more Americans who are uninsured than otherwise would have been the case. And what that means for hospitals is that if those folks show up in the emergency room, the hospital has to stabilize them. They have to take on costs to pay for that person's treatment, even if that person cannot afford to pay for it themselves. And so, from a hospital's perspective, they're concerned about what we call uncompensated care. So someone shows up in the ER, by law, the hospital has to stabilize them, and so that could add, a lot of strain to, a hospital's budget, especially rural hospitals that might already be struggling financially. It could be enough to tip them over the edge into either having to cut certain services. That might mean, like, for example, we're seeing rural hospitals cutting, like, labor delivery services or things like that, or just having to close altogether.
So when you go back and you take a look at who is on the enhanced subsidies on Obamacare, it's interesting to me, and you can tell me whether my observation is right or wrong, that those states that expanded Medicaid, have fewer people who are using the enhanced subsidies, because those people, their income falls within the Medicaid guidelines. They're able to get Medicaid, and a lot of them, and we can talk about how these people are actually working, but still qualify for Medicaid benefits. But when you look at the states, and usually red states, that have not expanded into, done the expansion of Medicaid, they're big users of these subsidies. And so how does that kind of shake out politically? I mean, when it's Texas and Florida and these red states that are really the ones that are going to get hurt. We don't know yet what the outcome's going to be on Medicaid. We assume that there's going to be a lot of people driven off Medicaid who then would have to go to the exchanges if they're going to buy health insurance. But this folly that Congress is on, that somehow this is going to affect only blue states, is just crazy to me.
Yeah, I mean, I think so. When you look at the last few years when the ACA or Obamacare enhanced tax credits have been in place, the number of people buying ACA or ACA marketplace plans has more than doubled in the last 5 years. But half of that doubling is concentrated in Texas, Florida, Georgia, and North Carolina. And like there are really a handful of southern states, in particular southern red states, that account for so much of this growth. And the reason for that is because these enhanced premium tax credits made health insurance essentially free for very low income people. They have a $0 premium payment. They do have a deductible, but it's $80, like 80, which is, incredibly small for private health insurance. And so those are the folks who, if they lived in a different state, they would be on Medicaid. They would have, pretty comprehensive medical coverage through Medicaid. But because their state did not expand Medicaid, they're getting these Obamacare plans and getting frankly a pretty good deal on them. And so that has made, that has been incredibly attractive for people to bring them into the market and to get that health insurance. And you're seeing that that's having an effect on the uninsured rate too, where, these are states that started out with really high uninsured rates. And now more and more people are getting covered.
So, Cynthia, here's what comes at me, and Heidi, you as well, on my talk show. I get hit a lot with, look, this is only the COVID increase. This isn't the Affordable Care Act. This is just what Joe Biden did in adding to the Affordable Care Act during the COVID crisis. I don't care which one of you take a run at that, but which one of you wants to answer the question that comes into my radio's show?
Dealer's choice.
Yeah. You go ahead, Cynthia.
Okay. All right. So I would say that, kind of looking at the long-term picture here, when the ACA was first passed in 2010, first of all, they were trying to pass it in a budget neutral way, and also, working with a lot of uncertainty about how much premiums would actually cost for someone who didn't get a subsidy. And it turned out that while health insurance coverage in the original Affordable Care Act structure was pretty affordable for many people, it did not work for other people. In particular, there were some people who did not get any tax credit at all, but they also saw their premiums go up because suddenly that insurance coverage was much more comprehensive and it was covering people with pre-existing conditions. And this is what was driving a lot of the criticism of the ACA, was that there were arguably some people who were harmed by it because they had high premiums that they maybe couldn't afford and they weren't getting any financial assistance to help them afford it. And so that's what drove a lot of the repeal and replace conversations in 2017. And of course, those measures failed. But then fast forward to 2019, when the Democrats were holding a primary election, a lot of the Democrats at the time were talking about Medicare for all, or Medicare for more, or Medicare for those who want it. But Biden was talking about building on the Affordable Care Act. And what he proposed in 2019 was something that looked very much like what these enhanced premium tax credits that ultimately got passed look like. But he was doing this before COVID, before we knew COVID was going to come. And so, the COVID relief package was the vehicle through which they got passed. But it's not like they were only first thought of because as a response to COVID. It was justified as a response to COVID because so many people were potentially losing their jobs or, needed health insurance during a pandemic. But the idea was already there before COVID.
Yeah, and I want to point out that the original Affordable Care Act mandated that all the states expand Medicaid. And that is the piece of the Affordable Care Act that was struck down by John Roberts on the Supreme Court. taking away those mandates. And so then states walked away. North Dakota, very red state, recognized very early on that Medicaid expansion at a 90-10 share, and only 10% of it's paid for by the state government, is a pretty good deal for our healthcare providers. I'd like to say that they were really worried about poor people getting health insurance. I think they were more worried about hospital administrators who were knocking on their door lobbying this. But this is the gap filler for states that have not expanded Medicaid. And the irony is the states that haven't expanded Medicaid tend to be more conservative, more red states, Joel. And so, you can spin that argument that this is just COVID relief and it should have triggered off. You could make that same argument that the tax bill of 17, which Trump passed, was a temporary stimulus package, but now we've expanded it. So, they always pick and choose what they're going to basically look at for continuation of public policy. But this is public policy, and that has worked in terms of getting more people through the door, probably saved a lot of lives in those states, and actually took a lot of economic pressure off. And this is at a time that affordability now is the buzzword, the political buzzword. And, when you look at healthcare, and Joel can attest to this, a lot of farm families, it's their largest cash outlay behind the inputs that they put in the farm is their health insurance and their healthcare. And so, this is, and this hasn't escaped Bill Cassidy, Senator Cassidy's notice, right? Physician, actually a pretty good guy, worked more in poverty medicine, so good on him, in Louisiana, and he's still fighting the fight. So, Cynthia, I know you're watching really closely. What's the chances in the next week that Congress will pass a package that will, in fact, stopgap this loss of coverage for so many Americans?
So there's a lot of proposals out there. There's everything. The Democrats have mostly unified around trying to extend the tax credits as they are, at least temporarily, until maybe buying some time to renegotiate them. Some moderate Democrats have been willing to cross over the aisle to talk to more moderate Republicans about maybe some compromise, maybe making some changes to how the tax credits work. And then on the Republican side of things, there's a lot of different ideas out there. There's, like I mentioned, some of the moderate Republicans are willing to maybe do a temporary extension of the current tax credits. And in fact, some of them actually voted with the Democrats on that last week. And whereas others, like Cassidy, like you mentioned, is coming up with a different idea, which is maybe instead of offering this as premium support, you offer it as help for deductibles and coinsurance, through this HSA or health savings account idea. And then you have others who would really just rather see the tax credits expire, or who want to do something that's not really adding any new money or new financial assistance in to offset the premium tax credits. But there's even some ideas out there that would effectively repeal and replace the ACA marketplaces as we know them. So it's, there's just so many different options out there that, like, I think the Republican Party is having a really hard time unifying around one of those, or at least not getting enough votes to pass it or to bring enough Democrats over to pass it. I do think what's really interesting just watching this play out is that I think there probably is a proposal out there that could get enough support of moderate Democrats and moderate Republicans to bring this forward. But it just hasn't had a pathway, a political pathway to get there. I think there's like an idea out there of how this could be changed to make it palatable to enough Republicans and enough Democrats, but politically it just hasn't gotten through.
So, Heidi, I'm going to direct this one at you. If you look at your caucus, they got blamed for the shutdown by many people. Anybody with an eye towards it might disagree, but the truth is, I think poll-wise showed it was about 50-50. Their whole focus was dealing with this, making sure this got dealt with. Now that it hasn't been dealt with, should the Democrats still be helping?
That's an excellent question. And, Democrats want people to have health insurance. They want to see solutions, but they aren't willing to buy off on some crazy notion. And I think, Cynthia, you'd agree that they have been against Obamacare or the Affordable Care Act for so many years, they just can't shift. And you know what it reminds me of? Everybody forgets this when
When
President
Heidi,
Johnson.
Heidi, when you say they, you mean the Republicans have
Yeah,
been
yeah,
okay. Got it.
right. The Republicans. I mean, John McCain, and I always say, and Lisa, and Susan Collins. We're all in it and saved the ASA. Right. That last minute vote. Everybody gives John credit for it. And I do too. But I always say Lisa and Susan played a big role. They just came in first. But when you look at kind of how ugly the feeling is against the ACA and against Obamacare, against a backdrop where now 65% of the people in this country think that it's working for them. And so, the polling has shifted. But I want to take you back to another example, which was when Lyndon Johnson passed Medicaid. I mean, in fact, Ronald Reagan was one of the people and the AMA were out there. They were trying to get it repealed for years and years and years and years. And it took, 50 years from the passage of Medicaid for the Republican Party to say, don't touch Medicaid. And so I think that, they've been wrong on, the Republicans have been wrong on healthcare policy for a lot of years. They passed Part D, which was that medical, medicine, but they never paid for it. And that was a budget buster because that was a huge component of healthcare costs and a huge growth component of healthcare costs. And so I'm going to throw it back to you, Cynthia. We pay too much for healthcare. I don't think there's any doubt about it. And people are frustrated. People, it's not like you go to Target and say, I'm going to buy a vacuum cleaner. You know what the price is. You go to the hospital. Well, what kind of insurance do you have? Who's negotiated for you? I mean, it just is overwhelming to try and figure out how, number one, what are we paying for? And number two, how do we fix it? And that really builds on a lot of people saying, Medicaid, Medicare for all, single payer, however you're going to say it, that we are moving in that direction anyway. And I know Kaiser's done a lot of study. So there's two things I want you to respond to. One, the work that you've been doing on the high deductible plans that I think has been really significant because it is a warning that this is a formula for disaster for low income families. But also, are we moving towards single payer, and does that make more sense?
Okay, a lot to unpack there, but yeah, I will do my best. So, just to put some numbers on it, in the United States, whether you're looking at it on a per person basis or as a share of our economy, as a share of our gross domestic product, we spend about twice as much on healthcare than similarly large and wealthy countries like in Europe or Canada or Japan or Australia spend. We spend a lot more on healthcare. And it's not because we're getting more healthcare. We actually get a little bit less healthcare by some measures. We have fewer doctor's visits and shorter hospital stays than people in those countries do. But we pay higher prices for each hospital stay, for each prescription drug, for each doctor's visit. It costs more than it does in other countries. Now, yes, single payer countries do spend a lot less. There's pros and cons of that, which I can obviously discuss, but it doesn't have to be single payer. There are other countries that have private health insurance systems that still spend a lot less than we do. And the reason for that is, there's a lot of potential explanations. I don't want to oversimplify this, but one thing that is unique about the United States is how little regulation there is, or how little involvement there is of the government, whether it's the state or federal government, in the negotiations that happen between hospitals or other providers and insurance companies. So, in the United States, there's very little regulation of how much insurance companies pay providers. In other countries, there are, reference prices or, direct regulations or that sort of thing that limit how much the payers or the insurance companies spend on those services, and then that can lead to lower prices overall for, whether it's taxpayers or people paying insurance premiums. Now, like you were saying before, when we go to the hospital, we don't know how much it's going to cost us. And so there have been some efforts. Even the first Trump administration used authority under the Affordable Care Act to create more price transparency so that hopefully people would be able to at least get an idea of how much it's going to cost them before they actually get there. But the reality is it's really hard to do that. It's really hard, like just with the way that our system works, even creating more transparent pricing is very difficult to implement. And so you often don't know. And when you have a high deductible plan, the reality is that many Americans do not have in their checking or savings account enough money to cover a deductible. A typical deductible is a couple $1,000s. For many people, it's even more than that. And a lot of Americans are just living paycheck to paycheck. They don't have that kind of savings. They don't have that kind of liquid assets to be able to meet their deductible or to meet their out-of-pocket maximum. And so, as deductibles go up, that can lead to cost barriers to getting the care that people need. It can also lead to medical debt. And so we're seeing that a lot of Americans are struggling with medical debt right now. And that can lead to other financial problems for them too.
Cynthia, you got your last $10 in your pocket. It's between this and getting this right and having milk. Okay. How are you going to bet on this thing? What happens?
I think that most likely what's going to happen is that the enhanced premium tax credits ultimately are expiring. I mean, basically, as if Congress didn't pass something by now, then at least in January, people are going to be paying more money for their premiums. I'd say maybe there's a 1 to 2% chance that something comes together in the last minute or maybe even in January. I'd say it's a very small chance. I think most likely what we're going to see is that a lot of people are just going to be paying a lot more for their health insurance next year. And that's ultimately going to mean that some people just go without health insurance too.
Yeah.
Well, you got to wonder if that's the goal, Heidi, right?
Well, I don't think it's the goal. I think the goal is to kill the Affordable Care Act and then create a crisis in healthcare once again. So fewer people, so we have more uninsured, and then there's an opportunity to have a discussion. The frustration that we should all have is show us the damn plan. You've been talking about this Trump talked about he was going to repeal and replace when he ran in 2016. We have not seen a plan, and we haven't seen a plan because Obamacare is a Republican plan. And people forget that. Bernie Sanders doesn't like Obamacare. He wanted single payer. He wanted Medicare for all. A lot of Democrats wanted, basically allow people to buy into a federal program, just like federal employees. Those were the two big Democratic ideas. And John McCain, when he was running against Obama, basically rolled out the Affordable Care Act. Mitt Romney did this in Massachusetts. It's the same plan. And so they can't stand it because it has a name on it they don't like, Obamacare. And so, their problem is that their plan got implemented and now they don't have a second plan. And these high deductible plans, I think if you're interested, any of our listeners, go out on KFF's website and read some of the warnings about what could happen with high deductible plans. Before we let you go, I want to just talk a little bit about Medicare Advantage, because a lot of people are making that decision. Is today the last day?
I think you're right. Yeah.
Yeah. I mean, we're probably a little late because this will air tomorrow, but the Medicare Advantage has been this kind of, okay, let's offer an alternative. Let's make the drug companies happy. Let's get them in. And now we're seeing a lot of these plans that were priced to basically get people to buy Medicare Advantage. They're ratcheting back. They're lowering their benefits. And people are trying to decide, do I go back on regular Medicare with a supplement? What do I do? And so tell us a little bit about the work that you all have been doing at KFF on Medicare Advantage.
Yeah. So, for those who are less familiar, so Medicare Advantage is meant to be the kind of private alternative to traditional Medicare, where you get your Medicare through a private insurance company. One of the benefits of it is that it has prescription drug coverage and everything kind of built into it.
Some
Um,
of them do,
some
not
of the,
all of
yeah.
them.
But like, so that can make it attractive. The other thing that makes it really attractive is that they often offer like gym memberships or other kinds of benefits that can be really appealing to someone who's turning 65 and is still, wanting to stay active or, that sort of thing. So it draws a lot of folks in because of those benefits and because of the low costs associated with it. But then what can happen is that when people actually get sick, they find out that maybe what they need isn't covered enough, or maybe they need to see a certain specialist and the network is really narrow and they can't find a doctor who would see them. Whereas with traditional Medicare, you can go to pretty much any doctor you want to go to. And then if people, when they get sick, when you're no longer 65, maybe now you're 70 or 75, and you might want to switch to traditional Medicare, you might not be able to get the supplemental plan that you need to get because you have new pre-existing conditions.
Yeah.
And so, I think people need to, when they're making this decision, just think about it in the long run, what is going to benefit you now, but also what is going to benefit you in 10, 15 years when you start needing a lot of healthcare.
Yeah, it's a real important decision. And I think you'll see all the advertising, which I think is a waste of money, trying to get people to sign on to Medicare Advantage. But people need to be very cautious about whether you stay on one of those plans or whether you transition back to Medicare, traditional Medicare with a traditional supplement plan, because you could get trapped with much higher G plans or much higher supplement costs because you have pre-existing conditions and they don't have to take you,
Mhm.
unlike other kinds of insurances.
Yeah, that's something that maybe a lot of people don't realize.
Yeah.
Yeah. Anyway,
Cynthia, I
oh
want to
well,
thank you for joining us on the hot dish today.
Yeah, sure thing.
Yeah, really appreciate it. I hope those doorknobs are working. If I know Doc, they're still turning, they're still getting you in. So I
they
do.
probably have 5 screws in them just to make sure.
You tighten them up to beat heck. Huh? I
Yeah,
know.
yeah. He's an overbuilder.
Yeah.
He's an overbuilder.
And he and I beat you in pinochle all the time, Heidi. But that's not.
Not all the
Yeah.
time. Not all the
Cynthia,
time.
good to visit with you.
Yeah, you
Well,
too.
and I hope as this goes on, we'll know more probably by the end of the year. You'll come back, and I just think this is something that there just cannot be enough dialogue in the public sphere from professionals like you who know the facts, who obviously aren't out there playing a partisan role, but are out there trying to make sure that everybody in America has affordable health insurance.
Well, thank you for having me. I'd be
Mm.
glad to come back.
You bet. Thanks
Great.
for joining us on the hot
Thanks.
dish.
Joel, the long awaited response from the administration to the mess that they made with tariffs and angering some of our best customers in rural America, especially soybean customers, $12 billion,
Are you
30% of what they're sending Argentina.
I was going to
Woo!
ask you if that was 40 billion or 12 billion, because you know what? My guys noticed. There's no question about that. I think the administration must have got some pushback on that, Heidi, because they're already talking about another one. But I'll tell you what, my audience, the people that don't farm, if they do another one right away, they're going to go nuts. They didn't like this one, Heidi.
Well, and soybeans, didn't soybeans go down about 50 cents a bushel right after it was announced? And so, this all has market implications. And farmers are smarter than this. They know that they can't sustain on government, on some kind of hand to mouth government assistance. They got to have their markets. They got to sell their soybeans. And so what are you hearing from, are they moving soybeans? Anything going to the West out the ports on the West Coast?
Yeah, no, a little bit.
Yeah,
But
no.
I mean, really, they're still
Trickle.
not selling soybeans. I mean, here's the thing. There are less farmers out there. Farms have gotten bigger. There's farm employees like we just talked about with the Affordable Care Act, but there's less farmers out there. So if you're going to give subsidies out, like you are this $12 billion, what you're going to do is tick more people because not everybody farms and there's more people that don't farm in these rural areas. So I don't know. I don't think it trickles down. I can tell you, as somebody who works in a rural area, who's reliant upon, farmers having money, I don't see farmers out there having money. That's the answer.
Well, and we're hearing rumors at that now is the time of the year that all the farm groups after harvest that they all get together and they all talk. And we're hearing rumors farmers not getting operating loans.
No.
The sugar beet farmers had devastating news, and it's going to have huge ramifications for a lot of people who plant sugar beets, which is an expensive crop to put in the ground. And you can blame sugar dumping or whatever that looks like, or you can blame the administration because they think cane sugar is better than beet sugar, which is stupid because sugar is sugar. Last
Yeah.
time I looked, but every time you turn around, you're hearing another story, and the stories coming from bankers is not good, even with the 12 billion.
No, let me ask you this. Was the Indiana state legislature a sign? Was it a sign that Republicans don't get up in the morning and fear this guy anymore?
I think it. I think the Indiana folks are just stubborn, probably, people like us who just don't like being pushed around, who know right and wrong. It's kind of like the Speaker of the House down in Arizona, Rusty, who stood up to Trump. There still are people out there who have principles. The more interesting thing is Marjorie Taylor Greene. Basically, what she's been talking about is she said, I'm always about 6 months ahead of the curve. She said, I'll say things, and then 6 months later, everybody's saying them. She's saying there is a lot of dissatisfaction. And Trump was furious about that 60 Minutes interview because it basically showed the underbelly of the MAGA movement. Huge story today in the Washington Post about how MAGA is furious with Trump for focusing on foreign policy, which you and I have talked about before. People forget that they want to, it's America first. Why are we doing anything with Venezuela? And so I think and people can see a war brewing and they don't like it. And so, and Trump has stubbornly refused to pivot on affordability. He went to Pennsylvania, gave an asinine speech, rambled on about nothing, and said it was a hoax. And he's talking to people who can't afford their health insurance, who can't afford their car insurance, who can't afford to have a tire blow on their car because they couldn't take it to the tire shop. And so he's tone deaf. And I think the MAGA movement, along with traditional Republicans, are getting very concerned, but not so concerned that they're going to take care of this healthcare problem.
Well, but here's the thing, and I said this on my radio show, got in some trouble for doing it. Quite
No,
frankly,
trouble?
yeah, I don't care.
Trouble.
I said this when Joe Biden and Donald Trump were running against each other. And for our people who love the hot dish, 1-800, be mad at me if you want. But 80-year-old men, 80-year-old women should not be president of the United States, period. When I saw him in Pennsylvania giving that speech, giving that talk, and then when I see him doing other talks, he looks like a really old man. Now, he always struggled keeping his concentration when speaking. I get that. And he always rambled on. But it's gotten worse, Heidi. His physical ability has gotten worse. The way he talks has gotten worse. What he says has gotten worse. And this is it's not even a year into his second term. And so, he's an old man, Hyde.
Yeah. And he's everybody who's hitched their star to him. And I include an old friend of mine, Lindsey Graham. When you start seeing the machetes come out and cutting the umbilical cord from Donald Trump, that's when you're going to see. And Lindsey's up for reelection. South Carolina is a state that's going to get hit by a lot of healthcare costs. He's got some baggage. I think there's some interesting candidates running in South Carolina. Not saying that he's going to lose, but I think that the Democrats in the Senate are feeling a lot more optimistic today because Trump hasn't pivoted.
Yeah.
because Trump continues to stick with the line that all of this is a hoax and it's not his fault.
This reminds me a lot of you in high school. You had bad friends there too. You know,
I had
I
good
mean,
friends in high school.
yeah, well, okay. Let's talk about Harlan Mueller. That's a whole nother issue. I mean,
He was the sheriff, by the way.
yeah,
Yeah.
he was actually he was a deputy then. He grew into a sheriff,
Yeah.
but he's good family friend. We're just joking. Uh, yeah, but I mean, here's the deal, Hyde. This was all done because they feared him. I'm not convinced that when they get in little groups of people anymore, that they fear him as much. I'm just not. I don't know if it's the people around him they got to fear or what. Now, I might be Marjorie Taylor Greene and be 6 months ahead in this conversation, but the hot dish will save it. But he's looking old. He's looking like he's about one step away from being feeble. I'm sorry, but we know what that feels like, and they're not going to like how it feels like.
Yeah, and Joel, he hasn't had a lot of wins. I mean, you can say the one big beautiful bill, okay. And if I hear one more, I mean, Bassett basically saying, "Oh, it's going to be 2,000 on average, 2,000 people dollars more in people's pockets." That's not true for the lower half of this country.
Yeah.
I mean, they don't pay $2,000 in taxes. I mean, so they're creating expectations from the big beautiful bill that will never materialize. And they are not addressing healthcare costs. They're not addressing home ownership costs. They're not addressing credit card debt. They're not addressing the things that they could actually address and show some sympathy for. And eventually, when you start seeing Republicans holding affordability hearings, that's when you know that the worm is turned.
Well, and the one thing that hasn't been talked a lot is credit card debt. Uh,
Well, I talk
you
about it
know,
all the time.
I know, but a couple K isn't going to solve credit card debt. You know that, and I know that, and so this has got to turn around.
Think about this. The last time I checked, and I have just absolutely told my kids, you're going to have a credit card, you pay it off every month. Do not carry a balance. That is the stupidest waste of your money. Of course, that's what the United States of America is doing, right? Putting everything on credit. But, last time I checked, my son's credit card interest rate was 28%.
Yeah,
That's almost 30% of the principal, and you aren't paying any principal.
yeah.
Think about that. I mean,
Well,
and that's something Trump promised to fix, and so did Elizabeth Warren. Get on it. Get on it. They don't need 28%. Swipe fees. The companies that have credit cards, and Josh Hawley did this, which I thought was really fascinating. He asked them, "What is your margin? How much profit do you make?" 50% profit on the backs of small business. Think about it. And now you see what small businesses are doing. They're basically giving discounts for people who don't pay with credit cards because they can't afford the swipe fees.
yeah.
And so, there's so much that you can point to. And at the same time that they're doing that, they're ratcheting back some of the good work that was done on fees, like airline fees, like, fees for concerts that the Biden administration took on. And now they've kind of reversed course. And when you talk to Republicans, you say, "What's going to save you?" They say mergers and acquisitions. And I go,
Yeah.
"Oh, trickle down. That's worked so well for you when you're dealing with macaroni and cheese issues." You're
Yeah.
just
Well,
not.
I'm just going to tell you this, folks. That shouldn't stop you from having a very Merry Christmas, going out there, buying a gift or two, and just because
Just
it's got
not so many pencils. You don't need
or
39
dolls.
pencils.
But to be reasonable about this, I'm going to tell you right now, Hyde, I got you a couple rings of deer sausage for Christmas again.
Well,
So
I just want to say that in our family, we usually exchange gifts, but there was threats about not buying presents.
yeah,
Threats.
and there should be.
Yeah.
We've got enough things that plug into enough things with cords on them.
Well,
So
and it is it if you have to put a present on a credit card and you can't afford to pay the monthly amount, the best thing that you can do for your kids is keep your family financially solvent. And I hate to sound like Scrooge, but
well,
yeah, being able to afford the groceries is more important than getting the latest, toy that some kid would want.
Well,
I mean,
and
we got coloring books, but you know,
we shared a toy. We got a dog once for Christmas for three of us kids, and I never got to pet it. And I was the one that owned a third of it. So, yeah, folks, Merry Christmas,
Merry
everybody. And
Christmas.
thanks
Have a
for
great
joining us for the
holiday.
Hot Dish. You bet.
Take care. Thanks for joining us today on The Hot Dish, brought to you by One Country Project, making sure the voices of the rest of us are heard in Washington.
Learn more at onecountryproject.org. That's onecountryproject.org. Follow us on Substack, Facebook, and Blue Sky. You can also find the One Country Project on YouTube, so be sure to like and subscribe to us there. We'll be back next week with more Hot Dish, comfort food for rural America.